Good morning and welcome to today's committee meeting for the Health and Wellbeing portfolio. My name is Councillor Argencio and I chair this committee. The meeting today is open to the public and will be broadcast, and the recording will also be available for people to view later through the Council's website. It is also possible the Sheffield Live TV will record and rebroadcast this meeting. We have not received any public questions or petitions by the deadline, therefore there are none. And please can I request that your mobile phones and other such equipment are switched off to silent mode so as not to disturb the conduct of the meeting. There is no fire test planned for today, so if there is an emergency evacuation, please take direction from the Town Hall staff. The assembly point is Studio Square. I will ask my colleagues to introduce themselves, starting on my left.
Laura McLean, Councillor for Walkley Ward.
Good morning, Councillor Julie Grooke, Stocksbridge and Fordham.
Good morning, Councillor Malachi Havey, and I am subbing for Martin Phipps.
Good morning, Councillor Steve Harris. I'm member for Graves Park Ward.
Morning, Councillor Sophie Thornton for Beechcliff and Greenhill Ward and Deputy Chair of the Policy Committee.
Thank you. Apologies for absence. We've received apologies from Councillor Martin Phipps, also Councillor Milsom. She's on her way. It's just public transport is not being cooperating this morning. And Councillor Gail Smith will join us just a tiny bit late for personal reasons. There are no items on the agenda. This is item 2 that require exclusion of the press or public, so we'll carry on. And item 3, declarations of interest. Are there any members who want to declare an interest in any of the items on the agenda? Brilliant. We'll move on to item 4.
I suppose for the interest of caution, just with overnight short breaks, as I'm an employee of Sheffield Main Cabin Gateway, where we have recently commissioned some overnight short breaks, but I'm not directly involved in that work in any way, so just for the interest of caution. Don't think so.
Thanks, Councillor Thornton. I'm advised that is okay. Yeah, brilliant, thank you. So item 4 is the minutes from last meeting. These are on page 11 of your pack, if you've got the printed version. Can I ask members to let me know if they think this is a true record of the meetings that we had on the 8th of November? Are there any matter arising on page 11? 12, 13, 14, 15, 16, 17, 18, or 19. So can we just take this as correct and move on to item 5? There's public questions and petition, and as I said previously, there have been no questions or petitions received by the deadline. And again, item 6, members' questions. Members of this committee are entitled to ask questions of the committee, but we have not received any, again, for the by the deadline. So we can move on to item 7, which is the work programme for this committee for the rest of the municipal year, and that starts on page 21. Fiona, do you want to talk us through that?
No problem, Angela. So yes, as Angela said, the work programme starts on page 21. As always, this is a standing item on all policy committee meetings, and it's an opportunity for you to raise any comments you might have on the current work programme. This is a live document, so it's something which we encourage you to have an input into. We've got obviously today's agenda there, and then we'll have 2 meetings before the end of this year. One in January on the 31st, and one in March. The agendas for these are looking, as I'm sure you can see, pretty busy. But if there's anything that you feel like needs adding, or anything that you feel like needs you'd like some expansion on, now's the time for you to raise that.
I have just one kind of item that I think may possibly be added after. I'm just reserving kind of wanted to listen to SNR this afternoon, just maybe to add something about our climate change statement as a committee. So possibly another item will have to be added either in January or March, but I'm still kind of waiting to speak to people and raise the issue in SNR. So there might be an extra item on one of the agendas, if that is okay. Okay, item 8, which is our first proper kind of report, and it's on page 35 of your pack, and it's Adult Care and Wellbeing, Equality, Diversity, Inclusion and Social Justice Delivery Plan. And I believe that John and Dawn, is John not here? So Dawn is presenting this item for us. Thank you very much. Dawn, if you could introduce yourself and your title, please, for people who don't know you. Thank you.
Hello, Dawn Massender, Chief Social Work Officer, and apologies from John, who was unable to make it today. Okay, so we all share the same values and goals to become an anti-racist organisation. So this report sits alongside the Together We Get Things Done plan and our new equalities framework that's been developed. Hence, to keep this aligned, as well as to review progress, we'll bring an update to you in 6 months, if that's okay. So anti-discriminatory practice is fundamental to us, and the 4 main acts relating to this are the Equalities Act of 2010, the Human Rights Act of 1998, the Mental Capacity Act of 2005, and the Care Act of 2014, which gives us our dedicated responsibilities. So in addition to this, we've included in our response and in the plan the issues that were raised from the SACMA report, the Sheffield Race Equality Commission, Council Plan, the ADAS Diverse by Design Key Principles, and feedback from the Festival of Involvement. Our 4 themes are working with people, providing support, leadership including workforce equality, and leadership including learning from recent workforce consultations and engagement events. Our 5 key priorities are knowing our workforce and communities, partnerships and accountability, practice learning and development, active and independent living, and creating a safe and inclusive work environment. So you'll find in the Appendix 1 our delivery plan for 24-25, and Appendix 2 our equality data. The plan is that we will also, going forward, also look at devising a plan around our council offer for people who have sensory impairments. Okay.
Thanks, Dawn. Do I have any questions from members on this report? As people who are, who are on the committee know, we ask for, questions about how we cater for different people with different needs, but also how we look after our staff who have, from very diverse backgrounds and with, individual needs. So this is something that is really important as we develop all our kind of work practices. So thank you very much for that. So if there are no questions about this report, there are recommendations on page 36 of your pack. It is recommended that Adult Health and Social Care Policy Committee endorse the Adult Care and Wellbeing, Equality, Diversity, Inclusion and Social Justice Delivery Plan 23-24, and request that the Strategic Director of Adult Care and Wellbeing continues to provide the committee with updates on progress against the delivery plan on a 6-monthly basis, including updates made based on ongoing learning. So are people happy to go with those recommendations? Brilliant. Thank you very much. Thanks, Dawn. And we go on to item 9, which is the DAS local account and annual performance report, and this is on page 63 of your pack. And Jonathan is presenting this for us.
Morning, Jonathan McKenna-Moore. I'm the Service Manager for Business Planning and Governance. Here to present the local account for this year. It's a retrospective report on our performance in 22-23 financial year, so it looks back at the performance there rather than an in-year report. Specifically, it looks at how we're delivering against our strategy and the goals set out there. It follows the same format as last year's report, which went for a more accessible format. And this year we've introduced a co-production approach when putting the report together. This involved a series of meetings with people who draw upon services, and we asked them what they wanted to know more about, what they were less interested in the existing report. So we have sections on the services we provide, safeguarding, the use of direct payments, our information offer, complaints, and the use of the budget. So the report will be published online following approval at the committee, and it's our intention to build on this approach next year, developing the co-production and engagement.
Thanks, Jonathan. Are there any questions or comments about this report? Thank you very much. I think from my personal perspective, it reads really well and it's really clear, and I think having it in a kind of easy read format is very helpful because the adult social care is so complex and is really difficult to navigate even if you work in a sector, and for people out there it's important to know what we do really, and also it's really good to see the progress and all the work that's been done in the year, so it's really good. So I think we kind of agreed on the signatories of this report, didn't we? So that will be formalised on the online report, so it will be accessible, and I think last year's is still there, isn't it? It will be accessible there. Brilliant, thank you, Jonathan. Oh, sorry, we've got recommendations. I apologise, I'm not kind of quite here today. It's like I'm feeling not very well today, so my brain is not in gear yet. So recommendations are on page 64. It is recommended that the Adult Health and Social Care Policy Committee 1 approve the local account for 22-23 for publication. So this is last municipal year, and thank members of the local account co-production group for their time and contribution in creating the local account. Are we all happy with those? Brilliant. Thanks, Jonathan and the team. And we go on to item 10, which is the Healthwatch commissioning strategy. This is on page 93 of your pack. And Alexis is going to present this for us.
Can you hear me? Yeah. So, many thanks, and pleased to present the Healthwatch report today. Firstly, I want to note the excellent work by Healthwatch, as demonstrated by their annual report and also the stakeholder session. Healthwatch act as a critical friend and also a valued organisation who promote the views of people across Sheffield, and they're absolutely a valued service across Sheffield. And I just want to start by noting that. The reason why we have the report here today is because the contract officially ends on March 2024. And it's been extended to enable the commissioning strategy to be undertaken, but also to gain legal advice, stakeholder feedback, and to undertake a soft market test as described in the report to meet our wider regulations. But in listening to the feedback from individuals, from stakeholders, and from Healthwatch, one of the key feedbacks when we were looking at the longer term commissioning strategy was actually to enable quality provision and to enable us to, for Healthwatch to really continue to build the local relationships, undertake its positive activity, as well as continue to go and develop that local understanding of services around in Sheffield, as well as undertake all the speak up reports that they do. What we need to have is that longer term provision. So for that reason, what we are looking to is to maintain stability for Healthwatch in the future. So we are seeking approval of a commissioning strategy for a 10-year contract from committee to that end to enable that quality of provision, and equally seeking committee to go and endorse the annual report for Healthwatch as a recognition of all the excellent work that Healthwatch undertake.
Thanks, Alexis. Are there any questions? Councillor Nelson.
Thank you, Chair. Thanks for the report, Alexis. I just want to say that you really can't thank Healthwatch enough for the kind of work they do, because it's quite unique, I think, in that feels not, different kind of scrutiny and diligence to what members do, and obviously, a different sphere from what officers can do. So as part of a sort of triangular relationship, it's really, really important. And the way they kind of seek out and amplify citizen voices, especially those who are less heard, really invaluable. I thought it's really welcome to see an emphasis on those sort of accessible and appropriate channels for individuals to raise safeguarding concerns. It's something that I and others have raised, having those really safe channels where people feel they can speak up. But bearing in mind the kind of concerns that we heard, I've heard personally through involvement events where people told us they'd not felt they'd had a secure way to raise a safeguarding or like care quality issue because there's a fear of negative repercussions. And I thought that a key element might be anonymity, and that's not particularly mentioned here, or at least like protection of the complainant's identity at certain key points in the complaints process. I didn't see that mentioned. I just wondered if that can be considered, and whether it could be written into the contractual arrangements that there should be a pathway that's anonymous if people need to raise concerns, just to ensure that there's never a case where someone feels they can't speak up. Thank you.
Thank you very much for that, and very much one of the reasons when we were undertaking the work to look at the longer term for Healthwatch was looking at not only how do we provide quality of provision, that we also building the learning from our festival involvement. And at September's committee, when we had the safeguarding delivery plan, one of the commitments I made was when looking at the Healthwatch future contractual arrangements, that we would also build within that exactly that as a safeguarding. And key to this will be also working out the pathways and working out the contractual arrangements that enable individuals to be able to speak up and raise concerns at any time, which to me is really important. And that to me was one of the key fundamental learnings from the festival involvement, which is why we've absolutely taken that process within the report. And the next stages from this will be, is once subject to approval today, then essentially the next stages will be to do soft market test, and then the procurement for Healthwatch, and then we'll build within that the pathways and the, as you describe, as part of the arrangements.
Thanks, Chair. And just come back on that as well, just I wanted to ask whether everybody who receives care from us and their support groups, families, peer support, whether they're all informed periodically about the Healthwatch and that's available. Just wondered how many people don't know that that's available as a channel, whether we could maybe look at if there's any improvement around that. And Chair, just to note that I think there's a date error in the report on page 6 of 9, or our page 98. It refers to something being completed in January 23. I think it's supposed to be January 24, just for clarity. That soft market test. It says it'll be completed in January 23. Sorry, just to be pedantic. And just, I wanted to question as well just why the Equalities Impact Assessment isn't signed off in that report. It says, has it been signed off, and the question's not answered and there's no date. Just want to be a bit careful about what, you know, when we publish any kind of impact assessment report, that they should be signed off when they're published. That's on page 107. Yeah. I could.
I could advise that the equalities assessment was signed off, so the officer who signed off is named in the page 94 of the report. I think it's because they are online, the equality impact assessments are completed. So, but the sign off was completed, and that's noted on page 94 of the report. And so that's the person who signs it off, and it's good to note. It's good diligence about the dates. So I think the key thing from this is that for the Healthwatch contract report is that as we are, you know, seeking approval for the commissioning strategy, and the key thing is for me is that as part of the Healthwatch work is as part of our, you know, building in, you know, an aim to have a 10-year arrangement. What this builds is the stability, but also the ability to promote Healthwatch and work in a, you know, and kind of build upon the really good foundations that we've got. And actually, I would say that the stakeholders' feedback that we had that session was really excellent, and that provided a great foundation, I think, for going forward and really to build not only the promotion of Healthwatch, but other ways in which we could work together to really make sure that people's voices are absolutely the core of what we do in adult care, which is what's core to me.
Thank you. Thanks, Alexis. Just to clarify, Healthwatch, having Healthwatch is a statutory requirement that we have to have. So the contract is coming to an end. We have to recommission it for 10 years. So in a way, we don't really have a choice. We have to do it. They are excellent and they're very diligent with the work. And what I particularly like about Healthwatch is the fact that they're not, they always use people's voice. They always raise what, individual people, so that lived experience of people, especially when people are having difficulty accessing, NHS services or social care services. The thing that is peculiar about this is that we are extending by 6 months the current contract, and this is because although we've known this since, we've been working on this since last summer, it's just because of some legal implication. To ensure that there is continuity, we are extending the contract whilst we prepare for the new 10-year commissioning for Healthwatch. So recommendations are on page 94, and they are as follow. So that the Adult Health and Social Care Policy Committee approves the Council commissioning a new Healthwatch contract for Sheffield with a contract period of 10 years with an estimated value of up to 2.4 million over 10 years. Number 2 notes the decision by the Strategic Director of Adult Care and Wellbeing to provide a 6-month extension to the current contractual arrangement to ensure continuity of service delivery whilst the commissioning strategy is being implemented, and endorses the Healthwatch annual report for the year 22-23. Are we happy with that? Brilliant. Thank you, Alexis. And we're going on to item 11, which is on page 145 of your pack, and this is Adult Care and Wellbeing Market Sustainability and Commissioning Update and Approval of the 24-25 care fees. And Catherine is presenting this. Thank you.
Hi, yes, thank you. My name is Catherine Bunting and I manage the Commissioning and Partnerships Service in Adult Care and Wellbeing. So this report tries to bring together some of the key elements that the commissioning and partnerships undertake to ensure that we've got a sufficient and sustainable care market. So that was first brought to committee as an approach in February 2023, and it sets out our approach to this around sufficiency, so making sure we have enough provision to meet current and future needs, that care is timely in its delivery and it provides choice for people. We also consider quality to provide ourselves assurance of the quality and effectiveness of the care that's being delivered, that it's personalised and that it delivers on our strategic outcomes. And then thirdly, we consider value for money. And that's both a duty to ensure that our care fees are enough to ensure a stable market, but also that it offers value for money for people purchasing care, including those people who purchase their own care. And so the report is set out in those three sections, really. Section 2 provides an update on the commissioning activity that we've taken in the last 6 months since my previous update to committee, and notes some of the key activity planned for the next 12 months. Section 3 provides an overview of the quality assurance developments that the service has been undertaking, and it asks committee for approval to consult on an escalation process. That's actually a flow chart currently provided at Appendix 3, which sets out the current processes that we've got in place, and you might not have it in colour actually, but the top two processes are very well established. I think they might have been in blue, and the one in green at the bottom. There are processes in place for every contract that we have, but what we want to do is develop that with providers, with our colleagues, to make sure that it's really consistent and clear across all of our contracts, and that's what we'd like to bring back following that consultation. And Section 4 seeks approval from the committee for our fee rates for 2024-2025. The key things that I'd ask committee to consider there are that for many of the services that we now procure, having undertaken that activity in the last 12 to 24 months, within the contractual documents, it does set out the council's process for fee uplifts each year, and the proposals in this report are consistent with those contractual documents. For care homes, the contractual position is still in process, still in development, and we have undertaken consultation with our care homes in the city. There is a summary in the report, but in brief, providers continue to report some financial pressures, including the increased rate of inflation and costs of delivering care at the moment in the city, but also around workforce retention. And I know committees had reports previously around our workforce development strategy. But linked to that, and linked, of course, to the fair cost of care exercise that we did, we're recommending an above inflation increase for our standard rate care homes of 11.11%. That represents an additional 2.22% above what the modelled inflation uplift would be. And we are asking for approval to use £840,000 from the Market Sustainability and Improvement Fund Workforce Grant to be able to fund that in the future year. And in light of the care homes market and the commissioning programme that we're doing, we would also recommend that we come back in the new year with an update both on our Transforming Care Homes commissioning programme and proposals for how Sheffield City Council can further move towards the fair cost of care, and the foundation living wage for our care workforce, bringing that together as a single piece of work. Happy to take questions.
Thank you, and it's really good, having sat in this chair for over a year now, it's really good to see how there is continuity, and we're really kind of trying to be on that trajectory. So thank you very much for that. Are there any questions from members regarding this report? Councillor Milsom.
Thank you, Chair. Catherine, thanks for the report. As you say, the committee's put a lot of work into this and co-working with you and the team, and really appreciate all the input that we've been able to have along the way, and that it's felt like quite a well-informed team effort, I would say. I think I doubt I'm the only member who remains a bit nervous about the long-term sort of security and sustainability of our care providers, and I know that's something we've talked about along the way as well. And I think the financial security of care workers, and we're obviously doing as much as we can towards that, and it's a continuing journey. I appreciate that, but I think in terms of you know, sort of the point in time that we're at today with this report and approving the uplift fees, I feel like I can't approve it without saying this out loud, because it does come with a bit of a caveat, really, that so full sustainability and stability and fair pay for everybody are really sort of impossible to achieve without more long-term investment from government, like that long-term stability of funding. Like, we're still waiting for the financial settlement to councils, aren't we, at this point, when we're approving this, before we know actually what the settlement is, and that's the cycle that we're forced into. So I think that's unsatisfactory and not anything we can do anything about, but I just feel I need to say it out loud as a caveat to accepting this. And I do think it's important to recognise what we're doing in terms of going well above inflation in the uplift, which feels like a bold step for us, and I really appreciate, you know, how much you've managed to find at a time when the core funding's been so badly slashed for the councils. But it's, you know, it's not necessarily going to bring that ultimate stability, even that kind of uplift. So I think whilst we're aware that some of our care providers are operating quite down to the wire financially, obviously we're going to continue to dig deep, and you've said, you know, we'll be getting more reports in the new year that inform how we can move further towards that, closing that fee gap. But having said all that, I want, you know, I want to leave it more as a thanks, and let's keep working together. And yes, let's accept the report and accept the steps that we can take today, but, you know, with that little caveat that still ongoing work, isn't it? I think in the end, high quality care, we mentioned high quality care, and that doesn't come without high quality pay packets as well. So that's the journey we're on, isn't it? Thank you.
Thank you. Thanks, Catherine. Thanks, Ruth, for that. I completely share. And just for people who are not, you know, involved with the committee, it looks like it's really easy when we're in here, but there is a lot of work that we've put in before today, and people have been in briefings and we've discussed with officers. So the documents that we get on the day have already been informed by our, you know, the members' scrutiny, really. So thank you very much, Ruth, for bringing that up. And we'll continue to work to get to a position where we have stability in the market, where we can support our providers, pay people a fair wage, and deliver very good services for the city in the context of the fact that we are underfunded by central government. So thank you very much. So there are, Laura, do you want to come in?
Thanks. Thank you. Just a quick question. I won't repeat what Ruth said, but just to echo what Ruth said. I won't repeat what she said there. So my other question was about the climate impact assessment. It was said that there wasn't one for this report, and I just wondered what the reasoning behind that was, because we've heard from the care sector they're struggling to make carbon reductions and things because of obviously the financial squeeze at the moment. So I just wondered if it's something that we should consider moving forward. Yeah, thank you.
Yeah, I think that's fair, and I think there was a short summary that I put in around the potential impact on the climate. That, of course, I think it's because it was just such a broad report. I would have possibly ended up bringing back a sort of climate impact assessment almost attached to our adult social care strategy. But point noted, absolutely. And it does tie in actually with sustainability of care, particularly for care homes, because the state of the buildings has a large impact on the cost of delivering care and what's possible for you as a provider. Yeah, we've got lots of information from different providers about whether they have purpose-built homes, how old they are, and the potential for them to access grants to improve their energy efficiency, which is obviously not only better for the planet and the population as a whole, but is more efficient for them to deliver. So that's an important highlight, and I will make sure that it's a more specific and thorough response in the March committee report.
Brilliant, thank you so much.
Thank you. So recommendations are on page 147. There's 8 of them. So I'm going to read them out to you. Number 1 is note the progress made in relation to provider support in the city and delivery a stable care market, including the outcome of the care and wellbeing tender, the tender of care and night services, the tender for standard residential provision, our technology-enabled care offer and developments, and our direct payment support service. Number 2, note progress made in implementing quality assurance, oversight and governance arrangements. Number 3, note the flow chart for provider escalation to the council covering contractual safeguarding and fee uplift requests set out in Appendix 3 and intention that offers will work in partnership with providers to will work in partnership with providers to develop an escalation framework based on this model to be brought back to committee in 2024, approves the use of £840,000 in 24-25 of the Market Sustainability and Improvement Fund, Workforce Fund, announced it in August 23, to further close the gap between the current weekly fee rate and the median fair cost of care output for standard residential care, approve the care fee for the financial year 24-25 as set out in the report. Note the report will be brought to March 24 committee, not 23, with an update on the delivery of the Transforming Care Homes Commissioning and Delivery Plan, and 7, approves that a report will be brought to March 24, again, committee setting out proposal for how Sheffield City Council can further move towards the fair cost of care and foundation living wage. And number 8, finally, delegates authority to the Strategic Director of Adult Care and Wellbeing in consultation with the Chair of the Adult Health and Social Care Policy Committee to agree any appropriate and proportionate fee increases requested by non-standard provision and by providers outside Sheffield, because cost pressure will vary from place to place. So could we just correct those kind of March 23, there are 2 in there that needs to be corrected to 24. Are people happy to? Yeah, it's good to have such a long list when I'm not feeling 100%, Catherine. Are people happy to approve these? Brilliant. Thank you very much. Thank you very much to the officer for being so patient with us on this particular report. And we are on item 12. Which is on page 201 of your pack. It's Adult Care Strategy Delivery and Service Performance Update. And I believe Alexis is presenting this report.
Thank you very much. So I just want to start off my presentation by saying a thank you to all social care staff in the city. Every day social care staff in the city do a really tremendously and fantastic job. And I want to start off by saying that because I think that needs to be heard and championed across the city. We have 17,500 care staff across the city who every single day are supporting people to do a fantastic job. And everything that is in here in terms of our performance and our strategy developments are really down to our workforce, who are the most valued. And so for me, the focus that we had earlier on about working towards the fair cost of care, that focus on equality and that anti-discriminatory practice is core to every single one of the 17,500 care workforce that we have in the city. So I wanted to start by saying that today. I also want to thank members, because members have been a really fantastic support to us as we went through a really, huge journey in adult care in Sheffield. So I want to say also a big thank you to members. And I want to say a big thank you to my team who have just worked with us, fantastically on our journey today. So in September, I spoke at the last update about our performance. And one of the things that we talked about with members about how do we become ambitious for the people of Sheffield, and the last update plus the performance objectives set that ambition for the future and set some clear ambitions for us to work on for the next 2 years. And the one thing that I've always tried to do in this role as a DAS is to be ambitious for the people of Sheffield and set the challenge and to say why not, why can't we, what can we do to reach the challenge? And I think we've managed to continue to deliver and deliver, which sets us in a good foundation for the future. Some key points I want to go and highlight is, first of all, is in terms of horizon scanning. Is over the last 3 or 4 months, what we've been doing is I've spoken at a couple of conferences online, so actually highlighting some of the good work that we've been doing in Sheffield. But equally, we've been looking and benchmarking and continuing to learn as a team, which we think is really important to continue to learn. Equally, there's going to be a DAS handbook. So DAS is a Director of Adult Social Services, and there's going to be a handbook launched in the new year. So once that's launched, I will bring that back to committee and assurance as to how I deliver upon the duties that are legally set for me to go and do that. And then also just want to know about CQC. CQC have now, as of has been signed off in terms of the framework, and the first set of local authorities will start to be announced. So as soon as I hear further information, I will let members know. But to give an assurance, we are preparing for CQC, and and I would say that everything that we've been trying to do through committee is a great preparation actually for that. And one of the key things I think has been really about Sheffield, I think has been fantastic, is the ability to be completely open and transparent on our journey, and to really be accountable for how we are performing to the public and to people of Sheffield. And that's so I think that's great. And another one to kind of want to note is in terms of ADAS. ADAS launched a survey and a newsletter earlier on just this month, and one of the key things that highlighted was actually the need for funding into social care, and I'm going to continue to go and say that, and not only in terms of ADAS but also my own role is just as highlighted earlier on, is a continued need for social care to have funding to ensure that our care workers in the city can ultimately receive the support that we should be able to provide. So I just want to note that there to the ADAS update. And in terms of some strategic developments, is to note, and particularly some of our ambitions is to moving towards a named worker approach. And for me, as we've went through a huge journey in adult care to go and move towards more personalised approaches and an infrastructure that supports that, one of the key things now, and it's really based on our I statements and our individuals' feedback, as to how we have across our workforce that named person that people could know is their person. And that could be so meaningfully and so important for a person to not have to have lots of different people being that person who they have to turn to. Having that one name worker is such a crucial thing for family members. So that's one of our ambitions that we will work towards over this next couple of years. Equally, continue to go and place citizens, families and carers' voices at the centre of driving change. All the strategies and all the key developments that we've taken forward over this last year have been really about keeping people's voices meaningfully at the centre of driving change. And for me, that's one of my big pride and joys, is to be able to go and take that forward and empower that across all that we do. Because that ability to have people's voices driving change means that change is meaningful and it's driven from the perspective of individuals. And equally, that continue to focus on wellbeing outcomes, and particularly the focus on employment and learning, because what our I statements and our data shows is that the area that we know is an area that has been of risk is access to employment for people with a learning disability and people experiencing mental health and autistic people, and that's something that I've heard many, many times. So it will be a key priority and focus for us to work with partners to go and increase opportunities for people across the city. And then finally, that increasing opportunities for people to live locally. We have people placed out of area because sometimes we can't get the care that we need locally, and part of our decommissioning exercises has been to have care local, so that from a point of view of individuals and family members, they're not having to go elsewhere to get the care that they should be able to receive. And one of our reports today is exactly about that, and that's having that approach where we both build internally and externally to do that, so that people should be able to see their family members when they can do. And equally, for me, what's really important, and Councillor Ruth Milson kind of raised it earlier on, was continue to learn from people, and experiences and satisfaction in social care services is really important to me, that people can speak up no matter where the access point is, and that we have the infrastructure to do that, but equally that people's experiences drive the change, and we continue to learn from that experiences from people and our workforce. So that then continues to enable us to, all the I statements and all our performances is in the dashboard attached, we continue to move in that positive trajectory for the future. So that's all I'm going to say. I just want to kind of say a massive thanks to all, because this is a team effort, and it's nice to have at the end of the year where we are moving continually in a positive direction.
Thank you, Alexis. And can I, on behalf of the committee, also convey our thanks to everybody who works in social care, all the officers in council, and also to you, obviously, for all your hard work on behalf of the city. I think from my point of view, before I take questions, if there are any, I think what is important is the fact that the ethos that we have is putting people at the centre of what we do. It sort of trickles down to everything else, and by default we also doing all the right things that CQC will be looking at. So we are not actually preparing for CQC, we're doing the right thing for people, and then that means that also we meet CQC requirements. I think that's really important, and that's our mindset. So are there any questions from members on this report? Okay, so there are two recommendations on page 202. So it recommends that Adult Health and Social Care Policy Committee notes the progress in delivering upon the adult care strategy, Living the Life You Want to Live. And number two, notes adult care and wellbeing performance at December 2023 in relation to each of the adult care and wellbeing priorities and our actions in response. Members happy to approve those, to note? Brilliant, thank you very much. And we are going on to item 13, which is on page 217 of your packs, and this is emergency overnight short breaks for people with learning disability and or autism. Thank you. Can I ask the officers to introduce themselves, please?
Hi, I'm Richard Johnson, I'm a Commission Officer.
Morning everyone, I'm Christine Anderson, Strategic Commissioning Manager.
Morning councillors and members, Andrew Weewall, Assistant Director, Adult Future Options. Thank you.
Richard.
Yeah, I'll try to keep this on point. This paper is just for the approval of emergency overnight short breaks commissioning strategy of people with learning disability, autistic people, and people experiencing mental health. So the purpose of the report really just sets out the importance of ensuring continuity for emergency overnight short breaks and how we intend to do that for the people of Sheffield. The report sets out the approach for the development of emergency overnight short breaks for the city, the implementation of a review group to co-produce a development for short breaks. For the recommendation, recommend that the Care Policy Committee approves the proposal to develop Sheffield City Council services, so our provider services, and also our commission services to ensure sufficiency of emergency overnight short breaks in the city. It also notes a commissioning strategy for the commissioning of emergency overnight short breaks, which we brought back to committee in March 2024, following soft market testing between December and February, which is set out later in the report as well. Just kind of a brief history really and background. So emergency overnight short breaks has been quite challenging to source local providers despite market engagement. The cohort of individuals who require emergency overnight short breaks, a robust, safe environment beyond that of a standard respite provision that we currently have in Sheffield. Due to this, members are asked to note that the proposal is to develop both Sheffield City Council and Commission services to ensure both sufficiency of short breaks arrangements and the agility to respond to changes in demand. It's anticipated this will both improve outcomes and experience of individuals as well as reduce the costs associated with emergency provision. Pardon me. So there's two work streams here. Work stream one is to develop Sheffield City Council provision. So I believe members have previously been briefed on Norfolk Lodge, which is a kind of model that we'll look to base it on and try and set up review groups and co-production to help try and design that as well. Again, the second work stream is the overnight emergency short breaks, so that'll be done through our adult future options framework under the Lot 3. And again, tried to work with providers to try and recognise the specialists and offer bespoke provision that's required. I think that's it. Other questions?
Thanks, Richard. Are there any questions from colleagues? Thank you very much for this. So basically, we've been asked to let you go and develop this for us. The recommendations are on page 218, and before I take them, there is a typo in there. In the first bullet point, there is the word council on the second line of the bullet point, and I've asked for clarification. The first bullet point says, approve the proposal to develop both Sheffield City Council and Commission services, subject to separate council approval. It should say approval by this committee. It's not going to council, as in council, full council, to ensure the sufficiency of emergency overnight short breaks arrangements in the city. So if we could take that word out and put by this committee or something to that effect. And notes that a commissioning strategy for the commissioning of emergency overnight short breaks will be brought to committee in March 2024, following the soft market testing between December 23 and February 24. Are members happy with officers going off and bringing us some proposals? Brilliant. Thank you very much, and thank you for all your hard work. Thank you. So we move on to item 14, which is on page 241 of your pack, and this is Adult Health and Social Care Financial Recovery Plan update. And we have Jonathan again presenting this. Thanks, Jonathan.
Hello again. I'm still Jonathan McKenna-Moore, the Service Manager for Business Planning and Governance. So this is the third quarterly report that we come to committee with, just updating on the in-year position and the recovery plan for savings. So the first two sections cover those areas. We have a 3.8 million overspend as of the end of November, and an updated savings forecast of 19 million against the 24 million pound target. Section 3 provides some more detail about the new grant funding that's been received. We previously brought a report to you explaining about the amounts of temporary funding and one-off funding that were part of the budget this year. So we've just provided some more detail on what those are and the specific things that we need to spend them on and report on. The majority of grant funding goes into our main budget, but there are a few things that we have to treat separately and report on separately. So one's linked to the fair cost of care exercise and fee rates, and we have one that came in the summer related to workforce, and then there's the discharge grant that comes through the Integrated Care Board. And so the report just has some tables in there just explaining the use of those funds to date. Section 4 of the report refers to the appeals process for the assessed contribution that individuals pay to the cost of their care. And then there's a table providing detail on the number of requests that have been received this calendar year. Just to explain, those are the formal appeals that have been made. There may have been more that were just dealt with by the team manager and didn't get to that process. The Section 5 provides some benchmarking comparisons on how Sheffield is doing in the context of our financial restrictions. In summary, we're performing relatively well compared to our neighbours, but we have identified the risks that the financial restrictions have put on delivery of statutory duties. There's an intention to conduct a best value report for the services we provide or commission. And finally, there's a section on the autumn statement and the 5 million additional pressure that been added to our costs for next year due to the increase in national living wage.
Thank you. Thank you so much. I mean, I was just trying to think where we were last year at this point in time in terms of how we were delivering on our budget, and it's really, you know, the work that the team has done in terms of trying to navigate the challenges is incredible. Obviously, we're not going to rest on our laurels, and we will keep pushing to get to the point where we can be sustainable. But are there any questions from members on this? So there are recommendations on page 242. We're just asked to note this, really. So it's note the update on the financial forecast for the delivery of savings in 23-24. Note the use of grant funding in line with approved allocations. Note the intention to conduct the best value audit in response to national benchmarks on financial performance, and request updates on progress with the implementation through our budget delivery report to future committee. Are people happy with those? Thank you. So those are approved. Thank you. And we go on to item 15, which I believe is our last item. And this is on page... Pardon? Yes, I think so. It's a good job I've got SNR this afternoon. So this is on page 253 of your packs, and we have Jane presenting for us. Thank you, Jane.
Thank you, Chair. I'm Jane Wilby, Head of Accounting. So the paper gives you an update on the Q2 budget monitoring position for the Council. Each committee gets the same update in December. So the committee's last update on the full position was in September on the Q1 position. At Q2, the Council's forecasting an overspend in the General Fund of 17.4 million against a net revenue budget of 487 million, which is a variance of 3.6% to budget. At Q1, we forecasted an overspend of 17.6, so not a big movement between quarters, but there was a large movement in Education, Children and Families Committee of 2 million. We recognised some income from health was not going to be delivered this year for integrated commissioning activities. The 2 million was offset through our capital financing budget. Economic conditions have continued to yield strong interest returns, and our investments, slippage in the capital programmes meant that it's delayed our need for borrowing and strengthened our overall cash position, so the interest returns have been above budget this year. The three main areas for overspend for the Council in general are adult social care, children's social care and homelessness. In children's, we've got huge challenges from rising costs of placements, somewhat caused by limited supply in the city, alongside a shortage of foster carers to support the demand. We've also got a rising cost of home-to-school transport. Homelessness has arisen post-lockdown, coupled with a shortage of affordable housing in the city and a limited range of options. Our use of hotel and bed and breakfast accommodation has reached an unsustainable and unaffordable level. The increase in homelessness is a national issue, and now there are more than 100,000 households in temporary accommodation, which is the highest for 20 years. The Adult Social Care Committee is forecast to overspend by 3.1 million against a net revenue budget of 155 million as at Q2. We've seen a huge investment in bringing down the average costs of care packages following the spike that we saw during the pandemic, but the service continues to be challenged by increasing demand and inflating cost base. Transformation funding is in place to support the agency teams to continue the review work and deliver the BIPs. The majority of the overspend relates now to the staffing in the short-term intervention and enablement teams. Service improvement plans are in place to stabilise these services. The savings plans in adults are on track to deliver 91% of the 31 million target, with the remaining debt to be delivered in 24-25. The Council's overall £47 million worth of savings targets are currently 80% on track to deliver, with a further 12% to be delivered next year. The issues in Sheffield are not unique, and councils across the country are experiencing the same challenges and financial context. We've seen 4 local authorities in the past 12 months declare insolvency, issuing 114 notices, Nottingham being the most recent name. Sheffield City Council has been able to manage its overspends by drawing from reserves from the past 2 financial years, and will do again this year if no further mitigations are brought forward. We did set aside 70 million of our reserves in 2021 for budget contingency, and we'll have 13 million remaining at the end of this year. Reserves can only be used once, and as a depleting as overspends continue. The autumn statement offered no reassurance from government that there will be additional funding for local authorities. The medium-term financial analysis was presented in September, and that highlighted a £61 million budget gap over the next 4 years, with 18 million falling into next year. Services have been developing solutions to meet next year's budget targets and have brought forward proposals to the most recent policy committee meetings. All policy committees will make the final decisions in December. Consultation on the proposals will need to take place, and further balancing options will probably need to be developed. The local government financial settlement is expected next week, and following that the impact needs to be assessed. On December the 21st, Strategy and Resources will be asked to make a recommendation on the savings to date. And then on the 21st of February, the Strategy and Resources Committee will be asked to recommend the full budget to Council. The Council must continue to drive the delivery of budgets, savings plans and tackle in-year overspends to prevent that budget gap from widening. The committee is asked to note the Council's financial position for Q2 as at 23-24. The Q3 position will be presented to committee in March. Thank you.
Thanks, Jane. Thank you for being so kind of clear and succinct with that. And I don't think in adult health and social care we've ever been in a position where we only overspend by 3.1 million by the end of the year. And taking into account that the savings that this committee had to make into the budget for this financial year were 47% of all the savings that the council had to make in that budget, I think it's really credit to how much work has gone into it. We'll do our best to bring that down as much as possible, but I think it's unrealistic to think that we can provide services to the highest standards without further funding from central government. I think locally we're trying to do as much as possible and being as efficient as possible. But thank you for that. And yes, we've had another SNR added in next week on the 21st. So so that's we have one this afternoon and one next week. I've got colleagues wanted to ask questions. I've got Councillor Gluckett and then Councillor Nelson.
Can I just agree with what the Chair said? Thank you for putting the budget over in a really clear way so that we can all understand the situation that is before us and the challenges that we need to meet and address. What a number of people have said this morning throughout the meeting is that we cannot get to where we need to be to provide the services and the care that the people of Sheffield need and deserve without funding from government, that we have the financial settlement due next week. So I would like to understand, please, what Sheffield City Council has done in terms of working with the government to make them understand the position and the pressures. What information have we been providing to them so that we are in the best possible place to make sure that when the settlement comes next week, they have understood where we are and are actually going some way towards meeting that, because ultimately that is their responsibility. And so I think it's important that we know what we have done in relation to asking the questions of government. Thank you.
Alexa, do you want to take that?
So it's a really good question, and ADAS nationally has provided information to government, and that was linked to Madaf's report about social care and its need, based on a survey of all directors, including myself, about our position. So we have collectively provided that information as a whole body to government, and that's included within Madaf's report, and we hope that the government hears the ADAS views.
Thank you. I have Councillor Milsom and then Councillor Rooney.
Thank you, Chair. I just wanted to ask around the reserve usage, because I think this is possibly for members of the public and maybe for members who are feel less confident around corporate budgeting. Can I ask around the reserve usage? So 70 million was set aside to mitigate pressures from 2021 onwards, and some of that has obviously been used, a large chunk of that has been used, and it's depleting, and I think it's easy to understand that that's a finite resource. Can I just ask what the position would be today if those reserves had not been set aside in that way and used in that way to mitigate? Were we in a position in 2021 where we could have achieved savings in a different way, or so we've put those reserves in? What would the position be now if we hadn't done that as a council?
I think we drove through the savings plans in previous years that had meant that we'd been able to control budgets and actually build up a healthy level of reserves to manage that financial contingency, which has been a really difficult thing that we've done over the past 10 years, given the fact that we've been in austerity. A lot of councils have not done the same thing, so we are in a much better place than a lot of councils are, which is why you're seeing a lot of the bankruptcy and solvency notices that are coming forward at the moment. So we do feel that we are in a more stable position because of that. However, I think, you know, if something does come up, it does kind of wipe those reserves out. And as we said, we get to the end of the year, we've only have 13 million remaining. It's not a huge amount to manage contingency on a net revenue budget of nearly £500 million. If we'd have not had those reserves, then, you know, we would have probably overspent to the same level. Potentially, you know, further controls may have come in place. We may have had to make further drastic cuts to services. I think the budget saving plans, as you rightly say, Chair, has been successful in adults this year. There's been a huge sort of push towards delivery of those savings plans, which has helped stabilise that position, because the more that we're not closing the in-year gap, the worse it gets for future years as that gap continues to widen as pressures keep coming forward. So I think the work that we have to do is to continue on that, really, and make sure that we're delivering on those savings plans where we can, and just keep driving efficiencies and value for money and services as we're seeing in the adults care and wellbeing service and this committee, really, the budgets. So I think we just need to see that across the council in general to make sure that we're not seeing that budget gap widening. But yeah, I think it's a really, really challenging financial context across the country that you are probably reading about on a daily basis.
Councillor Rooney.
Thank you, Chair. First of all, apology for the late arrival. The bus service, unfortunately, I don't have a choice. I have one bus, and if that bus doesn't turn up, then I'm in trouble. My question is a sort of what if. I mean, if the government in 2010 hadn't made the political choice to impose austerity, where would we be financially if the normal system of grant allocation had continued? So how much have they taken off us? And I'm just trying to get, well, not necessarily for me because I've got a rough idea, but people who may not be aware, the disparity of reduction in income between certain parts of the country. So we've had, and different parts of the government Whitehall machine, because local government has taken the biggest cut compared to other parts, and the north of the country has taken a bigger cut than the south. And I've not heard anybody actually yet justify or explain why that is the case. And I mean, the response from government when Nottingham went bust was, it's your fault. Well, no, it isn't. It's their fault. So I'm sorry about that. I went rambled there a bit, but you know, if you could sort of pick anything you can make sense of out of that and answer it, that would be good.
Thank you. When we looked at our core spending power reduction over the past 10 years, in Sheffield we've seen a reduction of about 30%. That compares nationally with about 20%. So you're right that, you know, ours has decreased. The amount that we've lost in spending power is actually, it's more comparatively than the national context, and that's partly due to the demographics and partly due to how the funding formula from government works. So yeah, 30% reduction overall.
Is on the number of families that are in temporary accommodation. Do you know what that number is in Sheffield and how much it's costing?
I can't tell you the number of families off the top of my head, but I can tell you that it's costing, in temporary accommodation, it's probably in the region of about it's costing the council about 5 million this year, and that's because we're unable to claim back from central government the full amount of housing benefit that we have to pay out to support the cost of those families in temporary accommodation.
Presumably we've done analysis of the causes of that, which is, generally speaking, lack of housing, eviction, no notice evictions and all that sort of thing. So it's costing about 5 million. Maybe we should ask for some of our money back from Rwanda, because they've got plenty of money, haven't they? And they're not actually used it yet, so maybe they could give us some back.
Shall I respond to that, Jane?
So we can sort out
I'm only letting you rumble because we're early, Councillor Rooney. I don't think it's fair to put Jane on the spot on a political point, as she's an officer. So we can talk about it again this afternoon as SNR and all out. I think there is no kind of denying that is the situation we're in because of the government that we have. So thank you, Jane. Are there any other questions? There are recommendations on this report on page 251. So it's only to note the updated information and management actions on the 23-24 revenue budget outturn as described in the report. Are people happy to note those? Brilliant. That brings us to the conclusion of this meeting. Can I just say that I want to express my wholehearted thanks to all officers and members for working so hard. The reason why we can conduct the meeting so swiftly is because people put a lot of hours every week working on briefings. The officers bring us loads of proposal issues, and lots of the members, not just spokespeople, attend those meetings. Even substitutes attend because people are so passionate about it. So thank you very much for your work. And next meeting of this committee is on the 31st of January 2024 at 10 a.m. Thank you, everybody.
Apologies for being